be cautious, and I can tell him that on that basis, the green list, and there's already some countries on the green list, as he knows, very attractive-looking destinations as far as I can see, but that list is going to be subject to review every 3 weeks.
Dave Dugan.
Many thanks, Mr Speaker. Last summer, COVID was almost fully suppressed in Scotland, and on current trends it looks like we're heading in that direction cautiously again. However, as international travel reopens, I know that many in my constituency are very concerned about new strains entering the country. So while our First Minister has welcomed the UK Government's current very cautious approach to travel, she won't sign up to any plans that might put Scotland's progress at risk. So will the Prime Minister confirm today what happens in the event that devolved nations' strategic ambitions are at odds with the UK Government's? How is compromise in that scenario reached that isn't simply England's way or the highway?
Well, I think if I may say, I think that the cooperation, levels of cooperation, in spite of the differences which are sometimes accentuated or emphasised for whatever reason, has been amazing. And if you look at what's happening in Scotland today, it's very close to what's happening in the rest of the UK. That's the level of cooperation that we're showing together.
Sir Edwardley.
Right at the end of his statement, the Prime Minister echoed the words of his predecessor, Sir Winston Churchill, in saying, "Let us go forwards together." Of course, 80 years ago, precisely, on the 12th of May 1941, his predecessor was standing right there in this devastated chamber and committed ourselves to freedoms in the future. But in that spirit, may I ask a practical question about the future? Just as we had compulsory ID cards in the war and they worked so successfully, would the Prime Minister acknowledge that if we'd had them now, the whole test and trace system would have worked superbly? They could be made to work in future. For instance, on your smartphone, it'd be clear that you'd been vaccinated or whether you'd been in touch with infections. All this is very interesting for the future. Now, my right honourable friend can't give a definitive answer now, but would he at least have an open mind about how we can deal with these pandemics in the future?
Well, I'm a long-standing admirer of the libertarian school of thought that I've generally associated with my right honourable friend. But he's making an interesting point about data, Mr. Speaker, and the importance of being able to access data fast and to help people. I think perhaps the idea of ID cards is a slightly different one, if I may respectfully suggest to him, and I think that we're still some way off that solution.
Right, let's head to Tim Furham. Tim.
Thank you, Mr. Speaker. As has been acknowledged already, it is Mental Health Awareness Week, and it's right that we note the huge impact of the COVID pandemic on the mental health, especially of our young people, and on their education. Will the Prime Minister then reconsider whether imposing a summer of cramming is really the wisest thing to force on students and teachers? And would he instead look at our outdoor education centres, many of which are based in Cumbria, of course, and who have been hit worse than pretty much any other part of the entire economy? And would he therefore agree to not just save outdoor education centres, but to deploy outdoor education by commissioning professionals from that sector to run an ambitious programme in schools and in outdoor settings to re-engage young people with a love of learning and to help to tackle the mental health crisis?
Well, Mr. Speaker, I don't think a summer of cramming is exactly how I would describe the programme for educational recovery that we have. It's very generous, it's broad-based, it's intended to help students, pupils, kids across the whole spectrum of abilities and to help them to make up the detriment to their learning. But can I say how warmly I welcome Cumbria's outdoor education approach, the alfresco learning that he supports. It sounds magnificent to me, Mr. Speaker, and I think it should be replicated across the entire country. And I look forward to hearing more about it.
Mark.
Mr. Speaker, I can just say to the Prime Minister that other venues are available, and the Forest of Dean would be fantastically keen to join in offering itself for outdoor education for children across the United Kingdom. I welcome what the Prime Minister said about being able to say more at the end of this month about relaxing all restrictions by the 21st of June, and he'll know I'll welcome that. But can I just take him to what he said in his statement about the winter? It's inevitable, I think, that we'll see an increase in COVID, as with other respiratory viruses, and there will be some increase in hospitalisations and deaths, although because of our incredible vaccination rollout and the effectiveness of our vaccines, that will be at a much lower level and one that will not overwhelm the National Health Service. So can he confirm that work is underway in government to make sure that even with that small increase because of the success of our vaccinations, that we'll learn to live with the consequences of COVID as we do with flu, and we won't need to shut down the country again in the winter?
Mr. Speaker, there is plainly a difference, as my right honourable friend understands very well, between a disease such as flu, which sadly causes every year a number of hospitalisations and death, perhaps in the thousands, and a disease which has the potential to replicate, to spread exponentially, and to overwhelm the NHS. And what we need to be absolutely certain of, Mr. Speaker, is that we're right in thinking that we've broken the connection between COVID transmission and hospitalisation or serious illness and death. And that's still the question that we really need to establish in the weeks and months ahead. I'm optimistic about it, Mr. Speaker, but that is I think the key issue. And I just want to make one point I should have said earlier to my friend behind me about weddings, Mr. Speaker. It's very important that for the purposes of the bans, we will be making an announcement within 28 days, as it were, of June the 21st, if you follow me, Mr. Speaker.
Let's go to Afzal Khan. Afzal.
Mr. Speaker, the Israeli government made the decision not to vaccinate more than 4.5 Palestinian citizens in Gaza and the West Bank, leaving this responsibility to the occupied territories' under-resourced healthcare system. Only several thousand Palestinians have been vaccinated, in contrast to the 4.2 million Israelis. In light of the shocking and appalling scenes in Jerusalem, where Israeli forces attacked worshippers, the Holy Al-Aqsa Mosque, and the healthcare units, will the Prime Minister outline what steps the government is taking to provide assistance to the Palestinians in this difficult time? And will he condemn the actions of the Israeli forces and accept that the only way forward is a two-state solution to ensure peace, health equality, and protection of human rights?
It is a statement that the Prime Minister made, but I'm sure he would like to answer the question.
Yes, Mr. Speaker. Well, he makes a fair point about the situation in Israel, and I must say that I'm deeply concerned by what we're seeing, and everybody is deeply concerned in this House by the scenes that we're seeing. I think we all want to see urgent de-escalation by both sides. And let me tell him that the position of this government is firmly behind his, in that we continue to believe that a two-state solution is the best way forward.
Simon Fell, are you ready?
Thank you, Mr. Speaker. I welcome the Prime Minister's announcement about a public inquiry. Mr. Speaker, when COVID first rolled into Barrow-in-Furness, we had a disproportionate impact from it due to a toxic mix of underlying health conditions. With that in mind, could the Prime Minister confirm that the inquiry will take a look at not just the actions the government did or didn't take, but also what we need to do to make sure we can build back healthier out of this pandemic?
Actually, I think he makes an extremely good point, my own friend. It's a very important point. And I hope that this is what they call a big teachable moment for the entire country about our obesity, about our fitness levels, about disparities across public provision, not just between affluent areas, but within regions of the country. The levelling up needs to take place, Mr. Speaker, and that's why that is the ambition of this government.
Sammy Wilson.
Thank you, Speaker. And can I welcome the Prime Minister's announcement of an inquiry as well. It is important because of the number of people who died, but also because of the millions of people who will live with the consequences of the policies adopted by ministers on the advice of their chief medical officers. Many people who have lost their lives because hospitals and surgeries were closed, people whose businesses were wrecked because of stop-go lockdowns, children whose education has been disrupted, affecting their life chances, and at the same time, There were many credible experts who questioned the modelling on which those policies were based, the impact that it had on the poor, and also the appropriateness of the actions and the consistency of the actions. Can the Prime Minister assure us that the inquiry will include listening to the views and examining the views of those experts and the issues which they have raised?
Well, I think he's only serving to underline, with his excellent points, the extreme difficulty of the decisions that governments in this country and around the world were forced to make, and the terrible balances that we had to strike. And I'm sure that the considerations that he raises will be looked at by the inquiry.
Felicity Buchan.
Thank you, Madam Deputy Speaker. I'd like to congratulate my right honourable friend on the huge success of the vaccine rollout. The economy in central London is hurting, partly because of the lack of commuters and partly because of the lack of international visitors. Can my right honourable friend confirm that the plan is to lift the work-at-home guidance as of June the 21st, providing we stay on track?
Prime Minister.
Mr. Speaker, that is certainly our intention, provided we stay on track. But you should, I want to be sure that people will wait until we're able to say that with more clarity a bit later on, because we must be guided by what's happening with the pandemic. And she's so right about London and the dynamism of London, and indeed any other of our great cities. They do depend on people to be able to have confidence to go to work. I think it will come back. I think it could come back remarkably quickly, but it does depend on keeping the virus down. Madam Deputy Speaker, forgive me.
We now go to Debbie Abrahams.
Madam Deputy Speaker, on the 22nd of February, the Prime Minister told the House that the PPE contracts are there on the record for everybody to see, and all the details are on the record. But what the Prime Minister told Parliament was not true. A large number of contracts were neither there for everybody to see or on the record, including a £23 million contract to Bunzl, which was not published until the 8th of March. The Ministerial Code states it is of paramount importance that ministers give accurate and truthful information to Parliament, correcting any inadvertent errors. So will the Prime Minister finally apologise to the House and the country for this misleading statement and ensure that the government's procurement practices during the pandemic are in the scope of the COVID inquiry?
I'm sure the Honourable Lady means inadvertently misleading. Prime Minister.
I'm sure she does, Mr. Speaker.
James Davis.
Deputy Speaker, as life continues to return towards normality and attention turns to how we can learn lessons from the pandemic, there remains an urgent need to tackle this country's problem with obesity. Following the Queen's speech, what reassurances can my right honourable friend give me that the government will continue to pursue this agenda with vigour?
Yes. I can give my own friend, who is a doctor, every possible assurance, Madam Deputy Speaker. I think that this is a struggle that many of us face, but we are, I'm afraid, one of the fattest countries in Europe, if not the fattest. And we have to, and that has medical consequences, and it is extremely costly, both medically and financially.
We now go to Rachel Maskell.
Thank you, Madam Deputy Speaker. In November, the Prime Minister, in response to my question on funding for charities through COVID-19, said in this chamber, and I quote, "We will be doing much more over the winter to support the voluntary sector." He has delivered nothing, absolutely nothing over the winter. Now 10 billion in debt. Tens of thousands of jobs have gone. Charities are scaling back and closing, and our communities are suffering. So will he tell the House why he made that empty promise and what he will not just say, but do to support our charities now at this critical time?
Madam Deputy Speaker, we've had huge support for businesses of all kinds, premises, cuts in business rates, Madam Deputy Speaker, cuts in VAT, furloughing, and the single best thing we can do for charities is getting non-essential retail opened again as we did, and allowing our economy to come back. And I think that the British people give huge amounts to charity. We're one of the most generous countries in the world, and I've no doubt that instinct has been there throughout this pandemic and will continue.
Now go to Jason McCartney.
Thank you, Madam Deputy Speaker. The NHS in Kirklees has now given over 50% of people who have been vaccinated their second dose. Will the Prime Minister join me in thanking our local NHS, GPs, community pharmacies and the wonderful volunteers at my local Honley Vaccination Centre who have all played a magnificent part in this superb effort, which now means we can proceed to the next step of the roadmap on Monday?
Yes, Madam Deputy Speaker, I want to thank everybody who's been involved in the vaccine rollout, and particularly those at the Honley Vaccination Centre.
Hopkins.
Thank you, Madam Deputy Speaker. The Public Administration and Constitutional Affairs Committee published a report last September that recommended the Government should announce the inquiry into the response to the coronavirus immediately to allow time to set up the Secretariat and other administrative functions, which should mean it could start taking evidence early next year. So that was 8 months ago. So I wish to support the comments made by my honourable friend, the Leader of the Opposition, that the statutory public inquiry should be set up as soon as possible before spring 2022. So may I also seek the assurances from the Prime Minister that a key element of the terms of reference will be to investigate why there was a disproportionate impact on our Black, Asian and other ethnic minority communities, and that any chair of the inquiry has an expert reference panel that is diverse and has community leaders involved.
I agree with her totally about the need to establish those facts and the impact on Black and minority ethnic groups, and what was driving that, what could have been done to mitigate that, and I'm sure that the inquiry will be suitably set up so as to address that amongst many, many other issues.
We now go to Bob Blackman.
Thank you very much, Madam Deputy Speaker. My right honourable friend will be well aware of the tremendous success of the vaccine programme in Harrow. Indeed, he visited the Hive Vaccination Centre very early on during the vaccination programme. What message does my right honourable friend have now for younger people who will be approaching the position whereby they'll be called for their vaccination so that we can ensure that all adults
Democratic questioners, so we're now going to have two Republican questioners. I now yield to the gentleman from Wisconsin, Mr. Grossman. You are now recognized for 5 minutes.
Yeah, Chief Conte, there were pipe bombs discovered outside RNC and DNC, and you were deployed to both locations, correct?
That's correct, sir. We assisted the United States Capitol Police. That's correct.
Okay. Has there been any progress made at all on who would have put these bombs there?
No arrests have been made, no suspects identified. Working with our partners on the federal side, there's been surveillance videos that have been released publicly showing that individual placing the pipe bombs, but no arrests have been made at this point.
How powerful were they? What type of damage would have been done if they went off?
It would have been significant damage, I'm sure.
Were there any other evidence of any other bombs that day anywhere?
No, just the two.
Okay. Can anybody ask how many people got in the building from the public that day? How many people total were in the Capitol? Do we have a number on that?
No, I don't have the exact number. I can comfortably say it was certainly over 1,000 people.
In the Capitol?
Inside of the Capitol.
Okay. And were some of those people led in the Capitol?
I can't say that the individuals were necessarily let in. Certainly, there's been surveillance video that shows after the Capitol was overrun at certain points. I mean, it was just like a floodgate where people were just flooding in. I don't know that the resources were necessarily in place to prevent the people who were there to prevent folks from getting in.
I'm not going to judge the actions of the police that day because obviously it's an unprecedented thing and they had to make quick decisions. I guess the question I have, of the 1,000 people who were let in the Capitol, how many, I guess I'll say, broke in the Capitol and how many were let in the Capitol?
I would say, and that's a hard number to parse out, but I think we know from video where we saw individuals breaking windows. There was also the video that was released of hundreds of officers that I had in the tunnel there that were trying to prevent individuals from gaining access. Again, not really a good count on that number, but I think it's safe to say that there are several individuals who forced their way and were not just let into the Capitol.
There's no question. I mean, that's what I wanted, just a general, you know, where 800 let in and 200 broke in. Was it, you know, 50 and 950? But we don't have any idea.
No, that's correct, sir. We do not.
Okay. And of the people who let in the Capitol, how many were disruptive in the Capitol? I talked to one of the Capitol Police. They told me a lot of people were just milling around. Can you tell me how many were? Do you have an estimate how many were just milling around and how many were doing damage?
No, I do not have that estimate. No, sir.
Okay. Okay. We'll go back to the pipe bombs. Did that cause, when you put people out there tracking down what happened to the bombs, did that cause you to deploy people away from the Capitol?
We had people deployed there first before they responded to the Capitol. And with respect to the previous question that you asked, you know, Capitol Police may be able to give you a better assessment based upon, you know, their view of the videos inside of the Capitol, how many were milling around and actually, you know, how many were let in.
Okay. There were clearly people who were doing something coordinated to get in the Capitol. I'm talking about the people scaling the walls, that sort of thing. Do we have any evidence on who those people were who were scaling the walls, and were they directed by a central group or person?
I think what we know for certain is that there were individuals who coordinated their efforts through radio communication and hand signals.
And who were they? Were they a member of a group?
I think some of the reports that have come out, you know, they represent certain groups that have been mentioned on the call.
Yeah, we don't know yet, though, huh? We don't know.
And that, I think the U.S. Attorney's Office is probably better suited to answer that. Obviously, upwards of 300 people have been arrested, and they are representative of various groups across the country that were involved in what we saw on January the 6th.
Okay. Were those 300 all doing damage, or were some of them, as one police officer told me, just milling around?
I don't have an answer for that, sir.
Okay.
I'm not certain. Clearly, there was significant damage done to the Capitol. I think we know that, but just what those specific groups, I'm not certain about that.
Yeah, okay. And just one follow-up. I encourage any listeners to research the 3 founders of Black Lives Matter, because it is something that concerns me so greatly that somebody who apparently were trained Marxists have gained such influence in our country, and people should really familiarize themselves with the backgrounds and what the founders of that organization stand for. Thank you.
The gentleman yields back. The gentlelady from Michigan, Ms. Tlaib, is now recognized for 5 minutes. Ms. Tlaib.
Thank you, Chairwoman. And just for folks to know, you know, I work closely with Movement for Black Lives, and these are folks that are really trying to push real efforts to try to recognize many of my Black neighbors' right to live without feeling truly unsafe or feeling like their own government is not supporting them. And it's also really important for colleagues as they're talking about these organizations to know these are some organizations that are literally made up of mothers who have lost their children that were killed by police violence. So just to be very clear, this is not some movement that just came about. It came about because, you know, state-funded violence killed their children. So I appreciate the Madam Chair in having this hearing. Mr. Rosen, I would like to discuss something that you didn't mention in your written testimony.